Welcome to another RZCares segment. Today we're here with a very special organization, Help a Diabetic Child Foundation.
Help a Diabetic Child Foundation purchases life-saving medical supplies, insulin, and provides services for children with financial needs.
Joining us virtually today are the founders of the Help a Diabetic Child Foundation, Joe and Tammy Balavich. Hi, Joe and Tammy. Can you please tell us who's joining us today and how the foundation was started?
Good morning, everybody. Thank you for having us. Joining us today from Help a Diabetic Child is Joe Balavich, co-founder, Dr. Michael Haller, who is our medical director, and Julia Reisman, who is our social media coordinator, who also has type 1 diabetes. In 2010, our 16-year-old son was diagnosed with type 1 diabetes. We soon realized two very important things. The first, this disease is not one where an individual can lead a normal life. And secondly, it is costly, even with health insurance. Within a few short months, we learned that there were a significant number of children who were unable to get adequate diabetes medical supplies for blood glucose testing, something that must be done multiple times daily, and insulin, which you need to inject multiple times daily. It was at this point where Help a Diabetic Child was formed as a nonprofit public charity with a mission to raise money to purchase glucose testing supplies and insulin for children and families in need.
So realizing that funding was one of our top priorities, we also knew that it was important for us to be associated with quality and substantial board of directors. And we were fortunate in being able to attract and acquire a board of directors that includes some of the world's best published individuals in the field of diabetes research, treatment, prevention, and cure. One in particular, as Tammy mentioned, is Dr. Mike Haller, who is our medical director and also the chief of pediatric endocrinology at the University of Florida College of Medicine.
Dr. Haller, you play an integral role in the foundation. How did you become involved? How is diabetes impacting the life of children and their families around the world? What are the risks they face?
Thanks, Kim. So I had the privilege of mentoring Joe and Tammy's daughter as she was a pre-med student here at the university. And through that opportunity, knew their family and then met their son who lives with type 1. And after she moved on to residency, they asked how they could get more involved in supporting the community. And that's how HADC was born. So I've really been involved with them since the very beginning. Type 1 diabetes is a really challenging disease. It's different than many others in that it requires 24/7 management. Kids and parents don't ever get a break. And it's not the kind of diagnosis where a doctor can tell somebody to take this particular medication the same way every day and come back and see me in a few months. It really does require constant management. So you add that on top of what is a tens of thousands of dollars a year investment to manage well, and you take a family who may not have those resources, it just creates the perfect storm to really see a lot of very, very challenging situations. So Joe and Tammy and the organization have really stepped up to do tremendous good for these families who are otherwise struggling to get the basics that they need to take care of their diabetes day in and day out.
I also have a question for Julia. Julia, you've been dedicating much of your time to this foundation. How did you become involved, and what are the financial burdens that are placed on families that most are not aware of?
Hi, Jessica. Thank you, everyone, for having me. I've been a type 1 diabetic for 16 years, and I got involved with HADC because my father knows Tammy and Joe, and he came home and told me the stories of different families and children, of how they struggle and how they ration their insulin because they cannot afford it. What a lot of people don't realize is, yes, insulin is a major part of diabetes and it is very expensive, but there's so many other components, insulin sites, reservoirs, glucagon pens, glucometers, test strips, doctor visits every 3 months that add up. And, we do need insulin to survive, but there is so many other moving parts to diabetes, and everything does cost money. And, I'm very lucky to still be on my father's health insurance. So I really, I have a special place in my heart for those people who are struggling. And, during the hard times that we are in, maybe have lost their insurance and are struggling to care for themselves. And, I want to do everything I can to do my part and give back to the community and bring awareness to this disease and help so many families so that no child should ever ration their insulin or have to choose between paying for their insulin or going to school.
Thank you for sharing, Julia. And thank you everyone for joining us today. Help a Diabetic Foundation is such a wonderful cause with a wonderful mission, and we want to help.
We want to donate $1,000 to help some of these families through the financial burdens that diabetes has presented to them. Thank you for all that you do.
Thank you so much.
Well, thank you on behalf of Help a Diabetic Child and all the families we serve. This is very much appreciated. Thank you very much.
For more information, or if you would like to donate to Help a Diabetic Child Foundation, please visit helpadiabeticchild.org. Until next time, remember, Rue Ziffra is in your community and on your side. Please stay safe and healthy, everyone.